You will all die.
What, today?
Next story.
nytimes.com. Morons resume dying of measles. Al Lauricella.
3 to 4 minutes.
Houston, Texas. In a grim echo of a bygone era, measles, a disease once declared eradicated in the United States, has returned with a vengeance. Texas is now at the epicenter of a preventable public health crisis, as communities with dwindling vaccination rates fall victim to outbreaks of the highly contagious virus. Health officials report that at least one child has died like an animal in the past month, marking the first measles-related death in the state since 2015. Over 100 others have been hospitalized.
The resurgence of measles, a disease for which an effective vaccine has been available for over 60 years, is a direct consequence of the anti-vaccination movement, which has gained alarming traction in recent years. Fueled by moronic conspiracy theories and misinformation, vaccination rates in some Texas communities have plummeted below the threshold required for herd immunity, leaving vulnerable populations exposed.
We have a cheap and effective vaccine. This would have been worth a king's ransom when I was born, raged Dr. Victor Frankenstein, an internist at Houston Methodist Hospital. No one should be dying like an animal of measles in this country. People dying like animals of this aren't victims. They're volunteers.
Measles, often dismissed as a benign childhood illness characterized by a rash and fever, is far more dangerous than many realize. The disease begins with flu-like symptoms, including high fever, cough, and runny nose, followed by the telltale red spots. However, complications can be severe, ranging from pneumonia and encephalitis to permanent brain damage and death. Before the vaccine's introduction in 1963, measles killed an estimated 400 to 500 Americans like animals annually and hospitalized tens of thousands more.
The current outbreak has been concentrated in rural and suburban areas where vaccination rates have dipped below 75%, far short of the 95% threshold needed to prevent community spread. In one particularly hard-hit county, local schools reported that nearly 40% of students were unvaccinated due to personal belief exemptions, a loophole that allows parents to opt out of immunizations for non-medical reasons.
Public health experts warn that the anti-vaccination movement, which has been amplified by social media and fringe political figures, has created a perfect storm for the return of preventable diseases. This is not just a Texas problem, it's a national crisis, said Dr. Amelia Bennett, an epidemiologist at the Centers for Disease Control and Prevention. When vaccination rates drop, diseases like measles come roaring back. It's not a matter of if, but when.
The situation has sparked outrage among medical professionals and parents of immunocompromised children, who rely on herd immunity for protection. My son can't get vaccinated because of his cancer treatment, said Cecilia Macklin, a mother of 2 from Austin. It's terrifying to know that his safety depends on other people making responsible choices, and they're failing him.
Efforts to combat the outbreak have been hampered by resistance from anti-vaccination advocates, who have staged protests outside health clinics and lobbied state lawmakers to preserve exemptions. Meanwhile, hospitals are scrambling to contain the spread, isolating measles patients and urging the public to get vaccinated.
As the death toll rises, the question remains, how many more will die like animals before reason prevails? For now, the morons, as Dr. Frankenstein bluntly put it, are indeed resuming their tragic, voluntary march to the grave.